Good morning, everyone. I am Dr. Khushi, Assistant Professor, D.Y. Patil College of Physiotherapy, Kolhapur. Today I will be taking a topic called as suspension therapy. It's an important topic of the first UPTH curriculum. The objectives for today's presentation would be that the students should understand about the brief definition of suspension therapy, what are the principles on which the suspension therapy is based, uses, advantages and disadvantages of the suspension therapy, the materials, instruments, ropes and everything used in suspension therapy and the various types of suspension therapy. By the end of the session, they should be able to give a brief introduction and explain about the principles, uses, advantages, disadvantages, the instrumentation and the various types, as I said. Now, what is suspension therapy? It is a special technique which includes various exercises which are given to a part or the entire body by suspending it with the help of slings and ropes on a suspension therapy frame. It helps in increasing the range of motion, power and it supports the body parts. So the invention of suspension therapy goes back to the times of World War I. During the British era, during the World War I, there was a female known as Guthrie Smith. She was a yachtswoman by profession but practicing as a masseuse. She was the in charge masseuse of a hospital unit in which all the injured and wounded men were given rehabilitation. They were staying in the hospital. Being of a short stature, she was experiencing extreme difficulty to mobilize and to take massage and a couple of exercises and movements for these injured men. So somehow she realized if we could suspend the limb back then, that time it was more easier as for her as well as for the patient. So she used some ropes and pulley and she just experimented putting a paralyzed patient with suspending his limb with ropes and pulleys, and she found that the patient could use the limb which he was first not able to use. So then she realized that it was because of eliminating the gravity position, and she invented the first suspension therapy frame, which is now modified and used in our rehab units and among all over the world. So the invention goes back to her, and we should be thankful to Guthrie Smith for creating such a lovely and a very small and not so hi-fi technology, but of very good use. Now, what are the principles on which the suspension therapy is based? First is the frictional force. Now we need to understand, as per the Newton's first law of motion, any body which is at rest will be at rest if it is left untouched by any external force. Similarly, any body which is in movement, which will be in movement without any external force. So the force of friction is one such force that helps in reducing or stopping of the movement. The most important principle of frictional force is used in suspension therapy frame and the suspension therapy units. I will explain about it as we go further. It helps in keeping the limb suspended over the ropes, the frictional force. Second is the pendulum force. Now everybody must have seen how a pendulum looks like. Back then in the old clocks, we were seeing that they always had a pendulum down, which used to oscillate to and fro with the time. Now what is a pendulum? Pendulum means a heavy material suspended by a weightless thread. So we see that the thread has to be weightless, which is attached to a mass, and once it is given some external force, we see that oscillatory to and fro movements are seen. When the force is applied, it results in to and fro movement. In human body also, we get to see such pendulums, mainly in the ball and socket variety of joints. Those are the shoulder and the hip joints. Forward leg movements and the arm swings while walking could be one very good example. Like how we walk, that is a kind of a pendular movement of our arms and the legs. Now in suspension therapy, such pendular motion is used to maintain the muscle property, to increase the range of motion and also lead to strengthening of the muscles. The third principle that we will be talking about is eliminating gravity movement. Now, gravity is one such force that is constantly acting on every object in this universe, be it a live or an animated object. Today we are standing, we require our anti-gravity muscles to constantly work against the gravity to maintain this erect posture. So same goes about when a muscle is injured or when there is some nerve injury, we get to see that for that muscle to lift against the gravity is slightly difficult. When we overcome this gravitational force, we see that some movements can be initiated in the weaker muscles by eliminating the gravity and doing it in a plane which eliminates the gravity and assisted by gravity. So that principle is of tremendous importance when it comes to suspension therapy. For this, you should know the various grades of MMT. MMT means manual muscle testing. It has basically 5 grades. Grade 0 of a muscle means it has no power. Grade 1 means there is just a flicker of contraction. Grade 2 means there is full range of motion but in eliminating gravity. So we are using grade 2 planes specially for suspension therapy, that we are assisting the gravity is assisting the movement instead of resisting the movement. That comes under the grade 2 MMT. The third grade is full range of motion against gravity. So in this, anti-gravity movements are performed. Grade 4 is minimal resistance against gravity in full range of motion. Grade 5 is maximal resistance against gravity and full range of motion. So these are the 5 grades of MMT. When we talk about suspension therapy, we work in at least minimum grade 2 patients. The patient should be having some power at least. Then there is a scope of suspending the limb and bringing about some movements. If the patient does not have any power, then the only type of suspension that can be used is vertical suspension, and that can help in relieving bed sores and etc. That I will talk further. So we will quickly revise the 3 principles on which suspension therapy is based. First was the principle of friction. If the friction is less, therefore the movement becomes smooth and easy. Also, the friction is used to stabilize the joint while it is suspended using the ropes and the cleats. So first was friction. Second was pendulum, in which the human body, we see the 2 pendular motions, that is in the arms and in the legs. Pendular force is also the kind of force and a type of suspension that we will be seeing further. And third is the eliminating gravity movement, which can be brought about by using the suspension therapy. What are the aims of the suspension therapy? Why we need the suspension therapy and what benefit we can achieve by using the suspension therapy? It helps in improving the joint range of motion. Now, for example, if the patient is completely on the bed, so rather than doing passive movements, we can bring about some active assisted movements and help in maintaining the property of the muscle. We can help in maintaining the joint range of motion, as well as there are certain techniques in which we can improve the joint range of motion. Then there are some techniques in which you can improve the muscle strengthening and the neuromuscular coordination using the suspension therapy equipments. Advantages and disadvantages. As I said, the biggest advantages back then was also to reduce the burden on the therapist. Now what happens, we see that many obese persons or many persons who are overweight and who are well heighted, and when the therapist is short statured and not so physically and not having so much of physical endurance to lift such heavy patients, in those patients suspension therapy can prove to be a boon because it reduces the burden of the therapist. So instead of the therapist lifting the limbs and taking care of the passive movements and the active assisted movements, the limb can be very well freely suspended and only the instructions are needed from the therapist side. So it reduces the burden of the therapist, especially in cases with obese patients, with paralysis, with your stroke, spinal cord injuries. It's easy to lift the limbs, as I said. The weight will be taken by the suspension therapy instrument. instruments and not on the physical therapist. Active movements can be performed easily with minimal friction. Now this point is particularly applicable in patients who are not able to do the grade 3 points. I mean in the grade 3 plane. So then we can suspend the limb in a grade 2 plane and bring about the movements which were actually impossible actively in the grade 3 plane. Now for example, if I have to move my elbow like this is the grade 3 plane. So instead I can suspend my arm with the help of the suspension therapy instrument and do this elbow flexion. So this is going to be my grade 2 elbow flexion, and this will be much easier as compared to grade 3 for a person who is going to have some kind of wound or injury to the nerve or weak muscles. So that was the active movement which can be performed with minimum friction because we are eliminating the gravity in this. The disadvantages as such is it's a quite complex mechanism and many equipments are required. So it requires some time for to gather all the instruments and then to arrange, to tie the knots, to arrange the pulleys and everything that we'll see ahead for one particular movement. Now for hip flexion extension or for a shoulder flexion extension, one certain position and certain instruments will be kept in that various positions and it can be used only for that position. Then when you want to bring about abduction, adduction, again the entire instrumentation has to be rearranged and realigned. So that's how it becomes that many equipments are required. So sometimes it becomes a little tedious. For the therapist it's a little bit complex. We'll see further in the processing part. We'll see how practically I will show you some ropes and everything on the pictures and then how it is tied. So that's the only disadvantages. It's a bit complex and tedious. Now this is the suspension therapy unit. As you can see, this entire unit, it was invented by late Mrs. Guthrie Smith. As I said, she was in charge of the British Depot Hospital. Now you can see that there is this square. This is called as meshwork. The same kind of meshwork can be seen here on the top. As you can see, this is a meshwork. The center between the two lines of the meshwork, this is called as a center point or a fixed point. The suspension therapy is always attached with the S hook on this fixed point only. The reason being, if it's going to be attached somewhere in the boxes among this line, it can slide easily. If it's attached to the center point, at the center it's going to get locked there and there will be no to and fro movements. So the suspension is always attached to this fixed point. Now talking about, this is a pulley. These are the various things which are used. This is a pling. This entire thing is the suspension therapy frame. This pling can be sometimes immobile, it can also be mobile. As I said, the meshwork. The various pulleys, ropes, wooden cleats are seen in this frame. Parts of the suspension. I explained in the previous slide about the fixed point. As I said, the center between the two intermingling meshwork is the center point. That is the fixed point. That is always used as the point of suspension. Then you have the supporting ropes, you have the slings, you have a wooden cleat, dog clip and S hook and a storage trolley to hold everything. Fixed point. As I said, it's a part of the meshwork at the top and at the sides of the suspension therapy. It is made of stainless steel plastic or a plastic coated steel. So the entire frame is usually made of stainless steel. We prefer stainless steel because it is rust free. It comes on the slightly higher expensive side, but it is obviously because we are going to use it on patients. We don't want that the frame gets rusted and then the hook will get rusted. It's going to spoil the slings and cause any damage. That's why a stainless steel apparatus is usually preferred. In the top and the head side presents the 5 cm metal mesh, and the remaining side is kept open. So we see that the meshwork was only there at the head side and at the top. The head side and at the top. Rest everything is open, free for movements. I already explained, this is another kind of suspension therapy frame in which you can see a meshwork up, there's a meshwork at the side, there's a plinth, pillows, bedsheet. Now we talk about the supporting ropes. Supporting ropes are most important because it's going to take the entire body or the limbs weight. Now there are different types of supporting ropes. Connecting ropes provide the attachment of the sling to the frame and are adjustable in length. So there's going to be a sling, then there's going to be the rope, and then that entire thing is going to be attached to the frame. So supporting ropes do the work of attachment. They are basically of three types. We have the single rope, we have the double rope, and we have the pulley rope. Talking about the single rope, as the name itself suggests, that it has a ring fixed at one end by which it is hung up. Means that there is only one point of suspension. That is, it's going to be attached to one end that will attach to the frame, and down it's going to be attached with the sling. The other end of rope then passes through one end of the wooden cleat, through the ring of a dog clip, and through the other side end of the cleat, and then it is knotted. The cleat is used for altering the length of the rope and should be held horizontal for movement and pulled oblique when supporting. So that I will show you when the cleat comes in the practical, that if it is kept a little bit horizontal, then you can move it up and down to adjust the patient's length, and when it is kept absolutely horizontal and not oblique, that time it's going to support. That is where the force of friction comes into play, that the rope then holds on the cleat by frictional resistance, as I explained. That once the cleat is attached to the rope, it does not move. It maintains, the wooden cleat maintains the position on the rope with the help of frictional resistance. When it is turned oblique, you can adjust the length. You can increase or decrease. Generally, the length of the rope is required is 1.5 meters or 150 centimeters. Now, this was about the single rope. As you can see here, this is the sling. It's a single sling. You have your suspension therapy frame. It is attached with the S-hook here. Now, this is the cleat here, and this is your single rope. And below, with the help of your dog cleat, or sometimes it has a attachment here, you can see a dog cleat, the rope is attached. So you see the frame here, this is the rope, this is the wooden cleat which is passed through the rope, and here with the help of a dog hook, the sling is attached. So this is how a single rope would look like, and a simple suspension would look like. As I said, this is explained in the lateral view and the anterior posterior view. This is your wooden cleat. You can see there is a knot here. Okay, a knot is tied. Now this wooden cleat, as I have shown here, if you turn it oblique, you can adjust the height of the rope and accordingly adjust as per the patient's requirement. If it is kept horizontal like that, it will stay like that because of frictional force. Okay, because of frictional force. And the knot here, it will not slide up or down. Only when you turn it oblique, it is going to go up and down. Now this is a dog clip, and here below this, your sling is going to be attached. Now we will talk about the double rope. As the name itself suggests, the double rope will have two pulleys, one at the upper end and other at the lower end. Single rope just had one pulley. Now this device gives a mechanical advantage of two, as there are two pulleys instead of a single pulley. So rope is shortened by pushing the cleat down and allowing the lifter to move with gravity at the same time as it offers a mechanical advantage of the two. So this is used for heavy parts, especially your pelvis, your thorax, or the heavy thighs that are needed to be supported. So in these cases we use the double rope. It helps in easing out the work. Instead of a single rope, it becomes sometimes difficult to manage the heavy limb or the thorax. In that case, we can use a double rope as it has double advantage of two pulleys. As we can see here, this is the S hook, this is one pulley and this is the other pulley. And here is your wooden cleat, this is the knot. You can see that two pulleys are used in this, and with the help of this you can again adjust the height. The sling is attached to this double pulley type of suspension, the double rope suspension. Now we will talk about the pulley rope. This has a dog clip attached at one end of the rope, which then passes over the wheel of the pulley. So here the dog clip is directly attached with the pulley rope. In this you don't have to tie everything, and the rope is directly passed through the wheel, and it resembles the position back then of if you would use a well and how the water was taken out from a well in the late 90s or the early 21st century, that people, the females, there was a pulley attached to the well and a bucket was tied and that bucket was dropped into the well, and from the outside, just by rowing the rope like this, the bucket of water used to come out, and in this way it was very easy for the females to take a very high volume of water out of the well. So the similar mechanism this pulley rope is based. The rope then passes through the cleat and a second dog clip. So here we use two dog clips. It is used for three-dimensional movements. Most important, that when you want to bring about rotatory movements, for example, when you want to bring about your supination, pronation, that cannot be actually performed using the single and the double rope. For that you require a pulley rope for three-dimensional movements. Your other type of suspension can only bring about two-dimensional movements. So this is the added advantage of the pulley rope. Now we talk about the slings. We have already spoken about the type of the ropes. Now we will talk about the various type of slings which are available in the suspension therapy. You have the single, you have the double, you have three-ring sling, and you have a head sling. So single and double is similar like the single and double rope. It's easy to remember. Then you have the three-ring sling, the name itself suggests, and the head sling. We will learn in detail about each and every sling. First is the single sling. The single sling are made of canvas bound with soft webbing and with a D-ring at each end. They measure 68 centimeters long and 17 centimeters wide. They are mainly used for supporting the less heavy joints like your elbow and knee joint, because you just have a small length and a small breadth, mainly the small breadth as compared to a double sling. So it cannot be used for very heavy limb, or when you want to use for very heavy patient, we prefer double sling. But for your elbow and the single sling is quite sufficient. Folded to support the wrist and the ankle. We will see how in the next slides. As you can see, this is a single sling. This is made of canvas material. It is not going to be too harsh on the patient's skin. There are two rings at the end, and that can be brought about here, as we have seen in the further slides. How a single sling is going to be used and attached to the rope. In this diagram, what we see is a three-ring sling. So there are 3 rings. Ring number 1, this is ring number 2 here, and a ring number 3. So this is a 3-ring sling. It can be folded and used, we will see further. We talk about the double sling. You can see the entire dimension of a double sling is almost double that of a single sling. The length as well as the breadth is more. It is a broad sling with D rings attached at each end. We can see that there were rings 1, 2, 3, 4, 5 and 6 rings are attached as compared to a single sling in which only 2 rings were attached. It is used to support your pelvis, thorax and thighs together, especially when the knees are to be kept straight. So as I said, it's used for supporting a heavy limb. The length is almost the same, but the breadth is more as compared to the single sling. It's almost 29 centimeters wide. The 3-ring sling. We have webbing slings. It consists of 3 D rings, 2 at the end and 1 in the middle, which can be moved. The length is somewhere approximately 75 centimeters and width is 3 to 4 centimeters wide. It is used only for the distal joints because it is too small. Imagine now you cannot cover the entire elbow or the knee using a 3D sling because it's very tiny and it will not be too supportive. So it is used only for the distal joints, that is your wrist and ankle. As you can see here, ring 1, ring 2 and ring 3. So these are your 3D slings and how a wrist is supported. There are 2 patterns. In this is a figure of 8 pattern. And this is another pattern where the rings are on the same side and the limb is suspended. This is how it would look when it is folded and this is how it would look when it is straight. 1, 2 and 3 rings. One at the middle, this can be removed and then it is at the sides. Only used for your distal joints, that is your wrist and your ankle. Talking about the head sling. The head sling in itself gives you an idea that it's going to be used for supporting the head when you want to do some range of motion. It is a short, split sling with its 2 halves stitched together at an angle to create a central slit. You can see how there is a central slit here. Now the slit is to accommodate the head of the patient. Okay, here the head is going to be placed right in the center. And otherwise it would look like a normal single sling which will have 2 rings at the end. This allows the head to rest supported at the back under the lower and upper part of the skull. So this is exactly where the head is going to rest. This can only be used for head, supporting the head. Now we'll talk about wooden cleat. As the name suggests, it is made up of wood and is used for altering the rope. This is the wooden cleat and I have shown before that how you can alter the rope. If it's going to be placed just horizontal, it's going to stay on that rope with the help of frictional force. But if you turn it oblique, you can adjust the height of the patient. So this is the wooden cleat. It is of wooden material. It has 2 or 3 holes for the ropes to pass. The rope itself holds the cleat by frictional resistance. So there are going to be holes in this. So there is 1 hole here and 1 hole here. Okay, if you see the cleat from this direction, you can see there are 2 or 3 holes. Those holes are obviously for the ropes to pass and to stay. And it can be tied with a knot here. This is without tying the wooden cleat and this is after tying. So you can either tie the rope with the wooden cleat or you can just keep a knot and it will stay. The dog clip and S hook. You can see the shape is in a form of S. This is the S hook. And this is the dog clip. This was very commonly used when you were a child. You would have had some toys, or especially boys would have these laser toys and all which they can attach all your bike keys or any keys with such kind of keychain. Here you can see if you push into this, it will open and you can attach it freely. This is your S hook and this is your dog clip. It is used to attach the supporting rope with the mesh. Mesh was at the top or at the side. So this can be directly put on the fixed point. It is used to attach the sling with the supporting rope. Also, you can use it one for supporting the rope with the suspension therapy frame and the other can be used used to attach the sling with the rope. So at two places this is used. Now we'll talk about the storage trolley. It is used for storage of the different types of the slings and rope and with the help of hooks. So sometimes this is kept just besides to the suspension therapy frame, or it can be below, or it can be even at the side, and all the equipments can be adjusted into the trolley. Now we talk about the different types of suspension. There are three main types. One, you have your vertical suspension, you have your axial suspension, and you have your pendular suspension. We will study about it in detail. We talk about vertical suspension. The name itself suggests that it's going to be right 90 degrees. Okay? The limb or the part which we are moving is going to be taken as the point of suspension. The COG of the body part or the body is taken as the point of suspension. Now COG means center of gravity. So if you want to suspend the entire body, you are going to take your center of gravity as your S2. And if you want to just suspend one limb, so if I am talking about upper limb, my center of gravity is going to pass somewhere just right above the elbow. So I am just going to suspend directly above the elbow. I will take a vertical lasso and support it right above the elbow if I am talking about the upper limb. If I am talking about the lower limb, it's going to be slightly around the knee joint. So the COG of the body part or the body, the entire body part of the body is taken as the point of suspension. It is used to provide support to the body parts of the patient. Vertical suspension per se cannot bring about any movement. It is just used as an accessory suspension or a supporting suspension when you want to use your pendular or your axial suspension. This suspension is used in support when you want to just hold the proximal end which you don't want to move. Otherwise, it can be used for just relaxation purposes or for preventing pressure sores. Now, if a patient is going to be bedridden for a very long period of time, if it's a bulky patient and timely positioning, every 2 hours is not possible. So for a few hours, we can place the entire body or that limb per se just in vertical suspension, and that will help in preventing the pressure sores, which are usually seen at the sacrum, at the ankle, behind your TA tendon, at the head. So that can be prevented using vertical suspension, and it eases the work of the nursing, the caregiver, and the physical therapist. The mechanism of movement of a vertical suspension. In using vertical suspension, the rope is fixed so that it hangs vertically right above the center of gravity of the part to be suspended. The rope is fixed so that it hangs vertically above, means exactly above the part or the COG of the part that has to be suspended. It is used for support as it tends to limit the movement of the part to a small range pendular movement on each side of the central resting point. Now, as I said that it is not used per se for giving any range of motion, because once it is vertically suspended, there is going to be hardly any range or very small degree pendular range that is going to be available. You cannot, when I am freely suspending the entire limb, I can hardly move only this much after suspending. So it cannot be used for giving any range of motion, but it can be used as a supporting role, that the proximal segment can be supported while we are moving the distal segment. Now in this you can see that we are bringing about elbow range of motion. This is a grade 2 plane, as I had explained earlier, that how the person is sitting and this kind of movement is brought about. So this is your grade 2 plane. It can be done in sitting on a chair, or we can be seated on the plane of the suspension therapy frame. So here the movement is occurring at the elbow, but a vertical suspension. This using a single sling, if you can see here, this is your vertical suspension, which is used to support the arm while the elbow is moving. So vertical suspension is used always in a supporting rope and along with another suspension Once the limb is attached, we cannot bring about the movement, but it is used with your axial and your pendular suspension. So here the arm is supported using your vertical suspension and the elbow is undergoing axial suspension, and you are able to do a range of motion. Now we talk about axial suspension. This is the most common type and most frequently used and extremely useful type of suspension. Here, mind you, the joint is taken as the point of suspension, not the center of gravity of the limb or the part which is moving. Exactly the joint. The joint which you want to bring about the movement, exactly there your S hook, your rope is going to be tied and the S hook is going to be right about the joint. Gravity is eliminated. We always do grade 2 movements in axial suspension. That grade 2 plane, we are assisting the gravity and eliminating, not grade 3 against the gravity. So your this movement, then it could be your abduction. Adduction can be in your sideline abduction, sideline flexion extension instead of a supine or a standing flexion extension. The main uses of your axial suspension is relaxation, maintaining the muscle property, increase in your blood circulation, increase in the venous and lymphatic drainage. Now obviously, if the if the patient is going to be bedridden, there is going to be impaired circulation. So once your movements start actively or passively, it's going to help maintain the muscle property, help the range of motion, it brings about relaxation and obviously improve the venous and the lymphatic drainage. Mechanism of movement. This occurs when all the ropes supporting a part are attached to one S hook. One S hook, mind you, which is fixed to a point immediately above the joint, which is to be moved. This occurs, the mechanism of movement of an axial suspension is that both the ropes, your primary and supporting, secondary supporting rope, is going to be attached to one common S hook, which is going to be placed right above the joint. So a common fixed point immediately above the center of the joint, which is to be moved. When such fixation is set up, the movement of the limb will be on a flat plane level with the floor. That means it's going to be in the level of the ground, it's going to be assisting the gravity or it's going to be eliminating the gravity, nothing against the floor or the perpendicular to the floor. In this way, pure angular movements are obtained. Now we can see here, we want to bring about the range of motion of the hip. So, this is the hip joint. This is your primary supporting rope. This is your secondary supporting rope. And both are attached to one common S hook. See, the limb which we are moving, the joint which we are doing is the hip in this. Your single sling, this is your single sling which is kept at the knee, and this is a vertical suspension, and this is your 3D ring sling which is suspending the ankle. Both these ropes are attached to one common S hook here, and this S hook is just above the hips joint line. So this is how an axial suspension is performed. As you can see here, if it would be vertical suspension of the hip, directly the sling would be kept at the hip and it would just be attached up. But no, it would be somewhere here. This would be for your vertical suspension, but this is an axial suspension, so it's going to be right at the center of the joint and not at the center of the gravity. COG and COH, center of the joint, the center of the hip joint. Now we'll talk something about the pendular suspension. The point of suspension is shifted away from the joint axis. Shifted away. Movement usually takes place against gravity. Till now we were talking about only grade 2 movements, grade 2 plane movements of elevating the gravity or supporting the gravity. But with the help of pendular suspension, we can do against the gravity. Muscles will be getting resistance while moving if the axis is shifted opposite to the movement. So slightly shifting opposite to the movement will give an added resistance to that movement, and we can use for strengthening of the muscle and for improving the endurance. Now if we want to give resistance, if the joint axis is shifted slightly away, that limb will have to have more force or more work for doing the movement as compared to when the axis is going to be right above the joint. This was not possible in your axial suspension. So the uses are for strength and for endurance mainly, which is not possible in your axial and vertical. Giving resistance is an important thing that we can achieve in only pendulous suspension. As we are coming to the end of it, I need you to tell me that which type of suspension is this? Any guesses? See, here I can explain you that the point of suspension is the joint here. There is one common SO which is just right above the shoulder joint, and here is your single sling, here is your 3D sling. This is attached to one rope here, this is attached to the second rope here, to one common SO. And here we can bring about your abduction, adduction, because the patient is going to be placed as supine, and freely abduction and adduction movements can be brought about. So this is a kind of axial suspension. Now in the same slide you can see that the patient is lying in prone, and this can be used again for your abduction and adduction. This is also a type of your axial suspension. Here again, my point of suspension is right at the joint. There is one sling, a 3D sling at the distal end, and another sling at the proximal end. You can see this is how a suspension would look like for the hip joint. The common S hook is placed right above the hip. You can see there is a single sling which is supporting the knee, and then there is an ankle which is attached with the 3D sling. But both are common attachment is at the S hook here at the fixed point. So this is an axial suspension for your hip joint. This can be used for bringing about the hip adduction and abduction in grade 2 play.